Let's start with Pfizer, because this was the one that caught everyone's eye. They're sort of spinning off, I guess, sort of a couple of their drugs that are coming off of patent protection, Lipitor, Viagra, two Xanax, household name kind of drugs, blockbuster drugs. Why is this deal so big?
The big word for this deal is scale. Basically, it allows Pfizer to put these drugs into a vehicle, combine them with Mylan's generic drugs business, and that business together will have more scale to compete in an environment where there's been brutal pricing pressure, particularly on that industry. So it gives them a little bit more power to push back on pricing. It also gives them broader geographic reach. So at the moment, Pfizer's very focused on China and Asia. Mylan has a complementary set of assets or footprints and networks. They're mostly in, they are very strong in emerging markets like Mexico and Brazil and Russia. So it combines those two things together.
And also Mylan's coming relatively cheap right now, right? It's like the second worst performer on the S&P this year.
Yeah, for Mylan, this is a really important lifeline. You know, they've been doing a strategic review for more than a year now, and everybody's been wondering what they're going to be able to pull off. They were suffering from a lot of debt, so they get to reduce and refinance that debt. And interestingly, it will be rated investment grade as well, so that's really good for them. And you know, Mylan shareholders will see the CEO, Heather Bresch, under whom the share price has been falling. They've come under a lot of fire for earnings misses. There's been congressional hearings on increasing prices on EpiPens and the like. So she's leaving. That's another positive for shareholders.
So also in this healthcare space, we had a big deal in the diagnostic space, that testing space with Genomic Health and Exact Sciences.
Yeah, so diagnostics is another hot area. Analysts are saying that it's going to be the next revolution in healthcare. So Exact Sciences is paying about $2.8 billion for Genomic Health. Again, geographical reach is a big factor there. They're getting access to 90 different markets around the world. And also they're getting a really experienced R&D team.
Geographic reach is the theme, I think, because LSE, the London Stock Exchange in the UK, hitting a record high as it too looks to purchase infrastructure abilities abroad, right?
Yeah, look, scale is a big buzzword at the moment, especially when you're getting towards the end of an M&A boom, right? We've had this cycle that's been going on for 8 or 9 years now, and people are doing these last-ditch sort of deals to see what they can quickly cobble together before it sort of runs out.